Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you. Welcome back to the show, and you just tuned in. I hope you've been here all night, but if you haven't, this is Dr. Creig Christensen, the chiropractor with the Independent Wellness Center, which we just opened up this week, 2080 East Calvada, right in the Calvada Eye, right across the street from the county complex and right next to the Veterans Clinic. So we'll be announcing on the show when we're going to do a grand opening. I mean, we just got that place open, and we're kind of been working, burning the midnight oil, trying to get. You did a remarkable job, you and your wife-to-be, just getting the furniture together and putting pictures up. And I mean, we were there to what, almost like 9, 10 o'clock last night, trying to get things
all week long last week.
Yeah, trying to get things ironed out and get things running. So and what's amazing is you still saw over 150 patients and carried on despite having total chaos in the office. So that's one thing about, I think, healthcare providers, is that we learn how to do it regardless of what the circumstances are. And it's nice to have a nice office and a plush office and all this other stuff, but really it's your mind and your physical touch. This is what people want. Yeah. And they want your time, and they want you to explain things, and they want to understand it, and so I think that's why we're both very successful, and that's why I won't work for corporate medicine, because I've done that, and it's an insult to my abilities for someone to tell me I have to see so many people and that I have to crank out so much business. I mean, I worked for Canyon Gate, and which was bought out by Healthcare Partners, but every referral had to go through a bean counter, because they had this shared risk model. And a shared risk model is that basically they get Healthcare Partners and anybody who's with Humana in their risk model pays $30,000 of that patient's health care, up to $30,000. After that patient goes over to the $30,000, Humana picks up the rest. So their bonuses and their structures are dependent upon how well they keep the patient out of the hospital, how well they do that. Now, that's both good and bad. I mean, the good part of it is that they're going to be more likely to do things for you that will keep you out of the urgent. That's why they have the urgent care in the hospital, because that's the most expensive point of service. However, when it comes to getting you certain things, they're gonna it's going to be tight. You know, it isn't like the faucet. So, and the current healthcare system is basically, I think, clogged. I mean, there's just a lot of people in there in the system, and I think there's a lot of things for you to do, because you can treat 60, 70 people a day, which is an amazing number. I mean, if I did that, I think I'd be dead at the end of the day, because there's not enough time in the day to treat 60 people. So I'm amazed at what you do. I really am.
Well, thank you.
I mean, and you do a great job. I mean, that's the thing. I mean, I don't step into many other. Well, this way, I hardly ever step into anybody else's office because I'm so busy in mine. But I've had the ability to step in your office a couple of times because we got so much going on, and I really like what I see. I really like.
Thanks, Mike.
The way people are really. Getting in touch with you. I knew that existed, but I didn't really know until I actually went in there and saw it. So, So, if you're out there and you got some degenerative disc disease, everybody does. You got some arthritis. We were talking about that on the break about what to do for it. Tylenol and anti-inflammatories. Why don't you come on in and give Dr. Christensen a chance to help you out. So we got Chuck again. Chuck, thanks for calling.
Hey, Doc, I just want to put a plug in for chiropractic and osteopaths. I had a degenerative disc for 20-something years, and it ended up with sciatica, which is the worst pain I've ever had in my life by far. And anyway, I went to both MDs and to chiropractic, and without a doubt, the chiropractors helped me so much. And the MDs, of course, were limited. They only had surgery, basically. And they all were honest and said, no guarantee it's going to work. But I really think that I really had a miraculous healing at its worst after the sciatica. I retired from the military and didn't have any stress getting back to Louis' thing. And I think the stress really aggravated the situation. And, I basically took it easy, I still exercised in that, but it absolutely went away. And I played golf since for many years and never had a reoccurrence.
Great.
And I have absolutely seen a chiropractor the whole time, and I really credit them with much of my success.
Yeah.
Thank you, Chuck.
That's good. And I think it's it's important to realize that surgery, for if you have a bad herniated disc, an incredibly bad herniated disc, you talked about decompression, where they do a laminectomy, they remove part of the bone so that the nerve can push out. Most of the time, sometimes cortisone injections can help to, but there's a lot, when the disc ruptures, there's a lot of substances, just like gout. I mean, they're not supposed to be in that place.
Exactly.
And they're very inflammatory towards the nerves. And so a lot of that pain is not necessarily compression, it's just foreign substances that are in there. And that's why over time, everybody's back pain, if you give it enough time, tends to get better. One of the things, we've talked about on the show a lot, the marijuana part of it, and chronic pain and things of that nature, and why I believe, there's this big push towards marijuana. The pharmacies are actually making it happen by their draconian, opioid prescriptions and how they're filling them. That's been a constant sore in my ass, if I don't mind saying, just because I had to write these prescriptions and the patients can't get them filled because this pharmacy doesn't want to stock more than this number, because if they stock more than this number, they have to maybe explain why they're stocking more than that number. And so these poor people can't get their medication. So alternative methods have to be developed to deal with that. Now, opioids, in my mind, for what we call somatic pain, back and body pain, or musculoskeletal joint pain, is really a dead-end street. And I've been telling a lot of my patients they have to figure out a way to reduce their opioid dependency, okay? Because there is no ceiling, but there is no ceiling to what I can write you and what I can prescribe for you, because the state and nobody's going to tell me I can't, okay? But in essence, the pharmacies are making it impossible for me to do that. Now, it's medical malfeasance, I think would be the term to say, to indiscriminately give someone a lot of opioids that they can't potentially fill down the road. You know the barriers there are to getting those prescriptions. You know the problems that exist out there. And with that being said, if you consistently ramp people's opioids up, you are actually part of the problem as much, not in the solution. So I tell people, listen, you got to cut back, even if it's 1 or 2 pills a week. Your body can handle that, so that you can get down to a lower amount, because I don't believe the pharmacies are movable, but you now have another option, which is mobility, because one of the things that happens to people when they get injured, osteoporosis is a big thing we've talked about on the show, weakening of the bones. And I heard it a long time ago that someone said, people that take chronic opioids have an increased risk of osteoporosis. Well, Is it the opioids that cause that? Absolutely not. It's because they're taking a medication that, number one, slows them down. Number two, they have a debilitating injury that they're taking it for. Okay.
Well, and they quit moving, as we talked earlier.
Exactly.
Wolff's Law states that the strength of bone is directly proportional to the amount of stress you put on it.
Exactly.
The reason we can't go to space for a year and 2 years is because of the demineralization of the bone.
Yep.
So, I mean, your musculoskeletal system, the bones in your body need to be stressed.
Yep. And that's true. So if you have osteoporosis and I give you a bisphosphonate, like one of those products out there, and I give you something and I give you calcium and vitamin D, if you basically live in space where there's no gravity, you're not going to build any bone mineral density.
No.
The only thing that builds density is the body's incredible mechanism for responding to stress. So Louis starts the show out with stress. So some stress is good. If you stress your bones, they actually start to lay down calcium because that's what the body does. Look at the person that's a redneck. Why is that person a redneck? Not because he lives in the South, but no, a person that works in the sun. When you get sunburn, your body actually thickens your skin, okay? And why does it do that? Because it wants to prevent further damage from UVB. Now, UVB is the long-wave radiation that penetrates deep down into your skin. UVA is the radiation that doesn't penetrate. And then for you out there, I know I've said it before, tanning beds are all UVA, okay? So people that would exist in tanning beds, their skin turns brown because it's got dark from UVA, but they didn't get the thickness in their skin to prevent them from UVB. So people that went to tanning booths were incredibly at risk for skin cancers because they got UVB deep into their body. So we have about a couple minutes left, and Shirley is on the phone. Shirley.
Yes, Dr. Reiner. I am your patient, and I wanted to know about, I used to do water aerobics. My back will not hold me upright. And I used to do water aerobics, and I was able to get it where it would, but now since I am here and don't know where to go to do anything like that, is there possibility that the doctor with you, Christensen,
Yes.
could help me?
I would think so. I mean, you won't know unless you come down there and let them take a look at you. But I mean, I think I don't know. Obviously, there's not many places to do water aerobics here in Pahrump, I would think, right?
Well, we're coming into the summer, and the pool's going to be open, and I think they offer water aerobics at the pool in the summer.
I don't know. But Shirley, yes. I mean, we didn't have that number, and we should have put it up on the screen. But you can call my office at the number below, 751-6111. What is the office number for the clinic? Do you know? Because I don't dial it. But
We just barely got it.
yeah, we just barely up there. We'll put that up on the screen starting next week for that. And if you call my office at that number, we'll get the number to you, Shirley, for the Independent Wellness Center.
Okay, thank you very much.
You're welcome. Thank you for calling
Shirley.
in. Yep. So thank you for that call. And certainly you probably have sounds like a pretty severe back there. And so probably the only way you can get exercise. And water is a buoyancy thing, and it's a very good thing for people to rebuild. I guess we need to put in a pool, right?
An aqua?
An aqua
portion.
spa?
That would be nice.
Yeah, that's expensive.
I would suggest that Shirley look at a recumbent bike
Okay.
or something where there's no stress on the spine.
No, that's a good point too. So, okay, well, this is unfortunately, we have a great show, a lot of callers. I really appreciate those, and I'll probably get Creig on the show next Monday night so we can continue this discussion and anything else. I want to thank you all for tuning in tonight, and we'll see you next Monday night. Thank you very much.
Thank you.
Thank you for coming.